You probably have many questions about your upcoming cardiac surgery, and that's normal. In this video, we will try to answer many of the questions you may have. The video is divided into 3 sections: before the surgery, during the surgery, and after the surgery. Let's start by distinguishing a cardiologist from a cardiac surgeon. Who does what exactly? The cardiologist takes the medical history, does the physical examination, does the treadmill test, also known as a stress test, as well as the EKG or other tests as required, performs the angiogram and other tests if necessary, prescribes the medication that is required, may put in stents or a pacemaker, does not operate, will refer you to a cardiac surgeon if you need an operation. The cardiac surgeon reviews the cardiologist's recommendations, meets with you before the surgery, takes your medical history, and does a physical examination, performs the cardiac surgery, does a follow-up before and after the surgery, and makes recommendations to ensure the success of the surgery and avoid possible complications. Here are some questions you may have about what will happen prior to the operation. Do you have to continue taking your medications until the day of surgery? Some medications, yes. Your cardiac surgeon, the one who will perform the operation, will tell you which medications to continue and which ones to stop. If you are unsure, feel free to call the office directly. Do I need to stop smoking before my surgery? Yes. It is better to stop smoking because it can reduce lung complications. It will improve the efficiency of the pain medication or painkillers and the healing of the incision. It will also help you to recover more quickly after the surgery. What determines how long the wait is before I get to have the surgery? Your wait time to have your cardiac surgery depends on your test results, your symptoms, and if other patients have a more urgent surgery. For this reason, your surgical date may change based on more urgent cases. There is a system in place to know which cases to prioritize. The surgeon's office will call you to tell you the date and time of your surgery. What should you do if your condition or symptoms change? If you have more shortness of breath, more chest pain, or other symptoms that are getting worse, do not hesitate to contact your cardiac surgeon or your cardiologist. If in doubt, go directly to the emergency department. Here are some questions you may have about what will happen one day before the operation. Do I have to fast before the operation? Yes. One day before the operation, you must not eat or drink after midnight. When will I be admitted to the hospital? The day of your surgery. If you are considered an emergency patient, you will already be in the hospital. Are there any tests that need to be done before the surgery? Yes. A blood test, a chest X-ray, a lung exam, or other tests may be ordered. The tests needed will depend on your condition. What should I bring with me to the hospital? You should bring an extra coughing pillow to be able to cough properly, pajamas or comfortable clothing, underwear, socks, shoes or slippers, all of your medications in their original pharmacy containers, your health card, a razor if necessary, personal care products such as soap or creams, toothbrush, toothpaste, etc. Do not bring anything with value. It is kind of like going on a trip for a few days. Why are the chest and legs shaved before surgery? A member of the nursing staff will shave your chest and legs so that everything is clean and ready for surgery. If you need a bypass surgery, the vein may be taken from the leg. Do I need to shower or bathe before the operation? Yes. The day before or the morning of the operation, it is important to bathe with an antibacterial or antiseptic soap that has been recommended to eliminate bacteria on your skin and reduce the risk of infection. It is recommended not to use any creams, powders, makeup, or scented products after you wash. How long do I have to stay in the hospital? Between 4 to 5 days on average after the surgery, depending on the state of your health. In some cases, the stay may be a little longer. When you are discharged from the hospital, please have someone drive you home. Is it normal to be stressed and always thinking about my surgery? Yes, it is quite normal. Everyone experiences the surgery in their own way. Most people prefer to prepare themselves mentally for the surgery and to know what is coming. This way, you will certainly feel better informed. Do not hesitate to ask questions to your cardiac surgeon or your cardiologist. They're there for you. During surgery. Here are some questions you may have concerning your cardiac surgery. What exactly will happen in the operating room? In this section, we will discuss what to do on the day of surgery, what will happen in the operating room, including different stages and steps, and the different types of cardiac surgery. On the day of the surgery. For patients who are out of the hospital, it is very important to make sure you arrive at the pre-op clinic on time. It is even better to arrive a little earlier. If you are already in the hospital, a staff member will pick you up in your room and bring you to the operating room. A few hours before your operation, you may receive a sedative to help you relax. You may need to take other medications if necessary. On the morning of the operation, it may be possible that your family can come for a short visit. Please verify with a staff member. Before you leave for the operating room, you may already have an intravenous in your arm to give you certain medications. When you are in the operating room, your family members may stay in a waiting room or come back to the hospital after the operation. Please verify with a staff member. Operating room. What happens in the operating room? There is a whole team present for you and your well-being. The cardiac surgeon is the person who will operate on your heart, and there's always someone to assist. The anesthesiologist is the person who will put you to sleep, monitor you, and administer the necessary medications throughout the surgery. The perfusionist is the person in charge of the heart-lung machine. The nursing staff are there to support the logistics of the operating room. Preparing for cardiac surgery. Don't be surprised. It is cold in the operating room. This is normal. The anesthesiologist will put you to sleep and intubate you, putting a tube in your mouth to help you breathe during the surgery. They will then place an intravenous line in your arm and another one on the side of your neck to give you the necessary medication for the operation, and will adjust it as needed during and after the operation. There will also be an arterial line placed in your wrist to take blood samples and measure your blood pressure. Step 1. Preparing the vessels for surgery. After making a vertical incision on your chest, the surgeon will open your sternum to access the heart. Usually, in the case of a bypass, the surgeon or the person assisting them will remove a vein from the leg. The mammary artery, which is in your chest, may also be used. It is possible that another artery, such as one in your arm, may be used. Step 2. Connecting the patient to the heart-lung machine. The cardiac surgeon will connect you to the heart-lung machine. Your heart will then be stopped to allow the surgery to be completed. This machine allows blood to flow through your body using a pump, and in fact, the heart-lung machine does the job that your heart and lungs normally do. The average surgery takes 4 to 5 hours. However, the more complex a case is, the longer the surgery can take. We will talk about the different types of cardiac surgery in the next section. At the end of the procedure, both sides of the sternum will be put back in place and secured with wires to make sure everything stays in place afterward. Types of cardiac surgery. What are the different types of cardiac surgery? There are several types. In this section, we'll explain the following common cardiac surgeries. Coronary artery bypass graft, or CABG, also called bypass surgery. Aortic, mitral, or tricuspid valve repair or replacement. Aortic replacement for aneurysm, or a combination of any of the surgeries listed. Let's see what is a bypass surgery. Why do I need bypass surgery? What is it for? Bypass surgery is the most common cardiac surgery. You need it when your arteries become too narrow or blocked due to plaques. Bypass surgery is like making one or more small bridges to go around what is blocked in the artery in order to bring oxygen-rich blood to areas of the heart that are lacking it. In this way, blood flow to the heart will be restored. These small bridges come from a vein or an artery that was taken at the beginning of the surgery. A patient may need one or more bypasses, depending on the number of areas that are blocked. Let's talk about cardiac valve repair or replacement. Why do I need a valve repair or replacement? What is it for? This type of surgery is an intervention that treats diseases that affect the aortic valve, mitral valve, or tricuspid valve when one of the following two possibilities have occurred. First, one of these heart valves does not open completely. As a result, the blood cannot flow freely, preventing the valve from functioning properly. Second, one of these heart valves does not close completely. As a result, more blood remains in the same chamber of the heart, making it difficult to circulate blood in the body as it should. If it is not possible to repair the defective valve, it will be replaced by a mechanical valve or an organ tissue valve. The mechanical valve. The mechanical valve is made of synthetic materials. It is often used for younger people and lasts a long time. It is important to know that this valve makes a ticking sound. Patients must also take blood thinners for the rest of their lives following this surgery to avoid blood clots and the risk of stroke. The organic tissue valve. Regarding the organic tissue valve, it comes from pigs or cows. This valve has been processed so that it is not rejected by the body following the surgery. The lifespan of the organic tissue valve is 15 years on average. This depends on the type of valve used and the age of the patient. It is often used in older people and is silent. Unlike the mechanical valve, it does not require the use of blood thinners for life. You can discuss with your cardiac surgeon the best choice of valve depending on your health and your condition. You must certainly be wondering if the replaced valve can be rejected. It is very rare for a valve to be rejected by the body. Let's see the aortic replacement. Why do I need an aortic replacement? What is it for? This procedure is necessary when you have an aneurysm of the aorta. An aneurysm is a dilation or swelling of a part of the aorta. The wall of the aorta that is damaged becomes weakened. When we talk about ascending aortic aneurysm, the bulge is at the top of the heart. You will need this type of cardiac surgery to prevent the aneurysm from growing and to prevent the rupture of the aortic wall. In this case, the cardiac surgeon will replace the damaged aortic wall with a tissue graft that has been treated. It is important to know that you may also have a combination of the surgeries mentioned. For example, you can have 2 bypasses and aortic valve replacement. What are the risks of having cardiac surgery? All surgeries carry a risk. The risks associated with cardiac surgery are heart attack, infection, arrhythmia, renal failure, stroke, bleeding, or death. Keep in mind that the risks of open heart surgery differ from patient to patient, so it is important to talk to your cardiac surgeon. What will cardiac surgery help or improve? In general, depending on your case, the different types of cardiac surgery can help relieve or improve chest pain, shortness of breath, jaw pain, upper back pain, lower chest pain, pain in the upper abdomen, dizziness, fainting, extreme fatigue, swelling of the ankles, among others. As mentioned previously in the video, after a cardiac surgery, the length of stay in the hospital is usually 4 to 5 days, depending on your condition. You will begin physiotherapy starting the first day because it's very important to sit up and walk as early as possible after the surgery. Some days will be more difficult than others, but you'll also have good days. Each day you will gain strength and make progress. As you recover, you'll be able to appreciate the full effects of the surgery more and more. Be patient and try to keep your spirits up by staying positive. After the surgery. We will now discuss what will happen after the surgery. In this section, we will talk about your stay in the intensive care unit or ICU, the beginning of the recovery process, and returning home. Let's first begin with the intensive care services. After your surgery, you will be taken to the intensive care unit or the ICU in a warm blanket. The intensivist, who is the doctor in the ICU, and the nursing staff will be at your side to ensure everything is okay. They will also monitor all of your vital signs. 1 hour after the surgery, if everything is going well, 1 or 2 of your family members may be able to come and see you. Your family will also be able to bring some of your personal items when they come to visit. If you have further questions, you can call the ICU to have more information about the visitation hours. The cardiac surgeon will talk to your family about how the surgery went. If your family is not at the hospital, the surgeon will call the phone number you provided. When you wake up after the anesthesia, you will hear sounds from different machines. You will also notice different tubes around you, like the endotracheal tube, bladder catheter, chest tubes, nasogastric tube, intravenous or IV lines, arterial line, and pacing wires. In the ICU, you will still be intubated because the endotracheal tube, which goes from the mouth to the throat, will be connected to a respiratory ventilator. This machine will help your breathing. Being intubated doesn't hurt, but you will not be able to talk. You will be able to communicate by blinking your eyes and using your hands to make gestures. You will also be able to use a pen and paper to write messages. The other machines around you are there to make sure everything is going well. These are normal procedures. It is also possible that someone from the nursing staff will remove the mucus from your lungs. This procedure can be uncomfortable, and you might feel like you're choking, but it only lasts a few seconds. When your vital signs are stable, you are completely awake and able to breathe on your own, the tube in your throat will be taken out. Usually, it is removed around 4 to 6 hours after the surgery. You may feel irritation and discomfort in your throat afterwards, but it will get better with time. You will also have a bladder catheter to help you urinate without needing to go to the bathroom. The urine will drain to a bag beside the bed, and the nursing staff will check that you are producing sufficient urine. The catheter will be removed 24 to 48 hours after the surgery if everything is going well. There will also be chest tubes right below your incision. Those tubes help to drain the excess liquid that could build up around your heart. They are usually removed 1 or 2 days after surgery. It's also possible that you may need a nasogastric tube. This tube is inserted in one of your nostrils and goes to your stomach. If you are not experiencing nausea, This tube is usually removed in under 24 hours. You will keep the intravenous in your arm for a few days. If you need other intravenous medicine, you will need to keep it longer. The intravenous in your neck will be removed before you leave the ICU. The arterial line looks like an intravenous and will be located on your wrist, inside an artery. It allows staff to take blood samples and to measure your blood pressure. This will also be removed before you leave the ICU. The pacing wires are wires of the pacemaker that stimulates your heart when it is beating slowly. Those wires will be taken out before you leave the hospital to go back home. In the ICU, your state will constantly be monitored by doctors and the nursing staff to make sure you recover well. Usually, if there are no complications, you will stay there for around 48 hours. Your cardiac surgeon or the surgeon on call at the hospital will come to see you each day to make sure that your recovery is going as expected. Do not hesitate to ask questions or to share your worries. The nursing staff are also there to support your recovery. Finally, a physiotherapist will come see you after your surgery to show you certain exercises to do during your stay at the hospital and when you've returned back home. After ICU, the beginning of the recovery process. After staying in the ICU for 2 days, you will be moved to a new room. You will stay there between 2 and 3 days, depending on your recovery. Do not forget to bring your personal belongings with you. Here are a few things to keep in mind for your recovery after the surgery. Post-operative pain. When you start becoming more active, you will feel pain around your incisions. This pain will decrease with time, but it can last a couple of weeks. Do not hesitate to ask one of the nursing staff for medication to manage the pain. It is important to take the medication regularly for them to be effective. Swollen ankles. Your ankles may be swollen, and you may even feel a burning sensation when you're standing up, especially on the leg where the vein was taken if you had one or a few bypasses. Don't worry, the swelling will decrease with time. You will need to walk regularly while standing straight to stimulate blood circulation in your legs and to allow better oxygenation of your lungs and heart. As your leg and your body start to recover, new vessels will take over the role of the veins that were taken out. Rest and sleep. It is important that you rest and sleep when needed. Shower and bath. You should take a fast shower as soon as possible when you arrive home. Do not let the shower stream hit your incisions directly, since they will be sensitive. Do not take a bath in the tub until your incisions are completely healed and the little scabs have fallen off. After your shower, dry your incision well by pressing lightly but without rubbing. The healing of the incisions. The nursing staff will clean the incisions when needed. There will be an incision on your chest. After the surgery, the incision on your chest needs to be exposed so it can air dry. When the incision is dry and there is no drainage, it can be washed gently with soap and water. The number of incisions and their length will vary from one patient to another, depending on their type of surgery. Some patients have only one incision in one leg. Other patients have incisions on both legs. It is also normal that there are bruises along and around the incision. The bruises will go away with time. There is also a possibility that a small quantity of light yellow drainage comes out of your incision. This is normal, and just like the bruises, will eventually stop. On the other hand, if the liquid is thick and a white-brown color, with or without a smell, call your family doctor or your cardiac surgeon. If you cannot reach them, go to an external clinic or the hospital emergency department, since it could be a sign of infection. You can have one or a few incisions on your legs and arms depending on the number of grafts necessary for the surgery. It can take up to 6 weeks for the incisions to heal completely and many months for their color to go from purple to red to pink and finally back to normal. You'll also feel pain in your leg or legs for some time, and that too is normal. You may also have bandages on your incisions. Stitches. Dissolvable stitches are used for the chest, the legs, and the arms. It is not necessary to remove them since they will go away on their own after some time. Weight gain. It is important to monitor your weight each day. If you gain between 3 to 5 pounds or 1.5 to 2.5 kilograms in just a few days, it could mean that you are retaining water. In this case, please mention it to your family doctor, your cardiologist, or your cardiac surgeon. Incentive spirometer. This device is used to prevent the collapse of your lungs after the surgery. The goal is to breathe in and lift the small ball in the tube for as long as possible in order to increase your pulmonary capacity and help avoid complications after surgery. It is necessary to use this device at least 5 to 10 times a day. The nursing staff will monitor your progress, and you will be encouraged to perform some specific activities when ready, such as coughing, deep breathing, eating, getting out of bed, sitting on a chair multiple times a day, walking multiple times down the hallway. Those activities will seem hard at the beginning, and that is normal. A few days after the surgery, you should be able to do them by yourself. During your recovery, it is possible that you may have problems sleeping or trouble staying asleep. It may be that you feel pain or just because you are in a new environment. You can ask the nursing staff for medicine to sleep if you prefer. It is possible that you will feel tired and that you'll feel the need to take a nap a few times a day. It is also possible you will be constipated because of the pain medication and the lack of physical activity. It can also be caused by the fact that you are not drinking enough liquids or not eating enough fruits and vegetables. For some relief, you can ask the nursing staff for medication that can help. It is possible that you won't be hungry or that you are feeling nauseated after the surgery. It is important that you still try to eat, even a little, maybe more often, so that your body can recover. For some relief, you can ask the nursing staff for medicine that controls nausea. You may have mood swings. This is normal since you just had a cardiac surgery. You will certainly go through different emotions. For example, you may feel like crying. On the third or fourth day, some patients report feeling sad. You can also feel anxious, mad, depressed, or in denial. It is important to have someone you trust that you can talk with to help manage those emotions. The emotions will go away after a few days. After being home for 2 weeks, if you persistently feel sad and desperate and you still don't seem to see the light at the end of the tunnel, please call your family doctor. Before returning home, one of the nursing staff will review with you the medications you need to take, your diet, and how to take care of your incisions. You may be prescribed new medication by your cardiac surgeon for various reasons, including to reduce cholesterol, called statins, to avoid blood clots, called blood thinners or anticoagulants, to reduce blood pressure and improve heart function, called ACE inhibitors, beta blockers, and calcium channel blockers, to reduce water retention in the body, called water pills or diuretics, to help regulate your heart rate, called antiarrhythmics. To ensure your well-being after you leave the hospital, we have created an additional section about going home. We will discuss how you can take good care of yourself when you're back home. Until then, take good care and have a speedy recovery. Returning home. Just before you leave the hospital, here are some important things to keep in mind. Review with the nursing staff your prescription medications, what to continue, stop, or add, how to take care of surgical incisions, and what diet to follow. Bring loose and comfortable clothing. Make sure to arrange your transportation back home, as you will not be able to drive your car for about 6 weeks. Also, you will still need to wear a seatbelt when you are a passenger. Finally, ask the nurses for pain medication about a half an hour before you leave the hospital. When you leave the hospital, you will begin your recovery from your heart surgery. At home, it will be easier for you if you move your bed to the main floor to avoid stairs for a few days. Have your refrigerator stocked with small dishes that are ready to reheat. Have compression stockings at home if required. Your recovery may seem slow at times. It usually takes 3 to 6 months to resume your normal level of activities. You will gradually feel better every day. Some days you will feel more tired, but other days you will feel more energetic. Remember that everyone is different and recovers at their own pace. Be patient and try to stay positive. Follow-up appointments after surgery. be sure to make an appointment after surgery with your family doctor, cardiologist, and cardiac surgeon. The family doctor should see you 2 to 3 weeks after your surgery. The cardiologist and cardiac surgeon should see you between 6 weeks and 3 months after you have been discharged. These follow-ups are important to make sure that you are progressing as expected. This is also the time to ask questions if you have any concerns. Don't forget your list of questions. If something is wrong and you're worried, do not hesitate to contact your family doctor or go to the emergency room. Taking good care of yourself. Pain management. The medications you have been prescribed will help you to control your pain. If the pain increases or the medication does not seem to be working, please contact your family doctor. If the pain you are experiencing is the same as it was before your surgery, contact your family doctor or cardiologist, as the pain should decrease and eventually disappear. Compression stockings, or anti-embolism stockings. A doctor may prescribe you compression stockings. If so, after you are discharged from the hospital, you should wear these compression stockings for 4 to 6 weeks, or longer if your ankles are still swollen. These stockings improve blood circulation and help reduce swelling in the legs. Please wear these stockings during the day and remove them at night unless otherwise indicated. For care, hand wash and dry flat to avoid wrinkles. Remember to keep your legs elevated to avoid swelling if you sit for long periods of time. Medical alert bracelets. Medical alert bracelets are recommended for all patients who have had heart surgery. You can find them or order them at your local pharmacy. Weight gain. As mentioned previously, please monitor your weight every day. If you gain 3 to 5 pounds or 1.5 to 2.5 kilograms in 24 hours, this may indicate that you are retaining water. If this is the case, please contact your family doctor, cardiologist, or cardiac surgeon. Instructions to follow after surgery. If you have a cold, flu, sore throat, or toothache, please tell the doctor or dentist that you recently had heart surgery. In this case, they may prescribe antibiotics if necessary. Medications. As mentioned earlier, these are the types of medications you will most likely need to take at home. Statins, to reduce cholesterol. Anticoagulants or blood thinners, to prevent blood clots. ACE inhibitors, beta blockers, and calcium channel blockers. These medications will help to reduce your blood pressure and improve your heart function. Diuretics, called water pills, to reduce excess water in your body. Antiarrhythmics, to help regulate your heartbeat. If you have any questions about the medications you are taking, please contact your pharmacist. Important things to know about your medications. For your medications, please take the prescribed dose. If you forget to take one, do not take 2 at the same time. Don't change your medication on your own. Don't stop your medication on your own. Your cardiologist or cardiac surgeon will decide which medications to continue and which to stop, depending on your condition. Stress management. To manage your stress following your surgery, you need to recognize the signs, find out where it's coming from, and develop strategies to reduce it. You can help yourself by listening to music, exercising or walking, visiting people, etc. Feel free to talk to people around you, write in a journal, or participate in new hobbies. Myths to deconstruct. Myth number 1. Heart surgery ends a normal sex life. False. Some people resume their sexual activities as if nothing happened. Some people may have some issues, and these may be related to physical changes or certain emotions, such as the stress of being in pain. Myth number 2. Heart surgery decreases libido and changes sexual functioning. False. These surgeries can cause a temporary decrease in sexual desire due to fatigue, depression, or medication side effects. Some medications can decrease libido. Most of these problems will improve with time. Myth number 3. Sexual activities are dangerous for someone who has had heart surgery. False. After surgery, you should not participate in sexual activities for the first 2 to 3 weeks. After that, you can gradually resume your sex life. Be aware that some positions are more comfortable than others. There is no medical basis for arguing that one sexual position is safer than another. Keep in mind that comfort and trust between partners is more important than the choice of position. In short, an honest discussion can be difficult, but is necessary, as this may be the first time a couple has explored and discussed these sexual issues. Share your feelings. Be honest. Make each other laugh. Enjoy your time together and experiment new ways to express your love and sexual desires. Nutrition. Making healthy food choices for your heart. Each meal should contain between 3 and 4 food groups. Please review Canada's Food Guide or contact a nutritionist if needed. Choose a variety of low-fat dairy products, such as skim or 1% milk, yogurt with 1% or less fat, frozen yogurt or frozen milk, low-fat cheese with 20% or less milk fat. Avoid saturated fats by choosing monounsaturated or polyunsaturated fats to help lower your cholesterol. It's also important to reduce salt in general. Check labels to ensure that sodium levels are low. Use fresh herbs, dried herbs, lemon juice, salt-free spices, and balsamic vinegar to add flavor to food. Here is a chart to help you make healthy food choices. Fruits and vegetables should make up half of your plate. Bread and grains should make up 1/4 of your plate. The same goes for protein at 1/4 of your plate. Here are some examples. For fruits, you can choose apricot, orange, mango, strawberry, raspberry, blueberries, dried fruits, kiwi. For vegetables, choose tomato, bell pepper, sweet potato, broccoli, peas, red cabbage, cauliflower, potatoes. For bread and grains, choose whole grain breads. For protein, choose lean meats, fish, hummus, tofu, red or white beans. For dairy products, choose skim milk or 1% milk, plain yogurt 1% or less, fruit yogurt 1% or less, frozen yogurt, cheese with less than 20% milk fat. For fats and oils, use in moderation and choose unsaturated fats, canola oil, sunflower oil, olive oil, sesame oil, mayonnaise, sour cream, or low-fat dressing, natural peanut butter, nuts like almonds, pistachios, etc. It is important to eat fish 2 to 3 times a week, vegetarian meals a few times a week. Please avoid eating partially hydrogenated fats such as butter, cheese, or sour cream, fried food, including food containing partially hydrogenated vegetable oils such as industrial cakes and cookies, French fries, potato chips, and other fried foods, industrially prepared meals. Vitamin K and Coumadin. Vitamin K is found in the vegetables that we eat. It is also produced by bacteria in your intestine and can be found in some multivitamins and mineral supplements. Coumadin is a medication that blocks the reuse of vitamin K in your liver. This vitamin is used to produce what is necessary for blood clotting and to stop bleeding. It is important to maintain a balance between vitamin K and Coumadin. Make sure the amount of vegetables containing vitamin K stays about the same each day. Vitamin K is found naturally in green vegetables such as spinach, broccoli, some types of lettuce, Brussels sprouts, cabbage, parsley, asparagus, kale, etc. Please continue to eat the same amount of food containing vitamin K each day. It is important not to suddenly increase the amount of food containing vitamin K, as the sudden increase may affect your blood clotting rate. Whenever your vitamin K intake changes, it is important to inform your doctor so that your INR test for blood clotting can be monitored more closely. Also, please keep in mind that alcohol can change the way the drug Coumadin works. Also, tell your doctor if you are taking any supplements such as vitamin A, E, or C, fish oils, flaxseed oil, or omega-3 or 6. General tips. How to have a good posture. When standing, Your chin should be parallel to the floor. You should also pull your shoulders back to stand up straight, even if you are in a little pain. If you keep your back rounded, it's not a good posture to heal properly. The back must be straight to avoid the muscles contracting. When you walk, it is very important to have a straight back, not bent, so that the healing can take place in the ideal body position. The pain that you might feel will diminish over time. Please be patient. When sitting, if you are sitting in a chair, slide your buttocks to the back of the chair. This will help keep your back straight and prevent the muscles in the front of your chest from becoming too tight. As with standing, to have a good posture, your chin should be parallel to the floor. You should also pull your shoulders back. How to get out of bed. If you are lying on your back, bend your knees and bring them up. Then, slowly roll to one side and slide your legs over the side of the bed. Slowly push up with your arms so you can sit up. Remember to keep breathing out as you push with your arms. Do the same thing when you return to bed. How to cough properly. When you cough, place a pillow against the incision on your chest. Coughing with the pillow will help to clear mucus from your lungs. Remember to hold the pillow close to you when you cough. This exercise will help you reduce pain, allow you to cough harder, improve the oxygenation of your lungs and blood. How to perform your breathing exercises. To do your breathing exercises, the nursing staff or physiotherapist will show you how to use the incentive spirometer properly while you are in the hospital. You can then take the device home with you. Breathing exercises with the spirometer should be done in an upright position, either sitting or standing. As mentioned before, the goal is to breathe in to lift the small balloon in the tube as long as possible to increase your lung capacity and avoid breathing complications after surgery. It is necessary to use this device at least 5 to 10 times a day. As soon as you are walking normally, you can stop using this device. Do you have to exercise? Absolutely. It is very important to exercise. Please start gradually and adjust your exercises according to the pain level you are experiencing. Doing exercises will allow you to strengthen your heart, improve or maintain your overall fitness, improve the endurance of your muscles, improve or maintain flexibility in your muscles and joints, improve your balance, facilitate your daily activities, increase your energy levels, help you burn more calories. Please check in your area or city to see if there is a rehabilitation or exercise center for people who have had heart surgery, also known as cardiac rehabilitation. Some recommendations. For the exercises, a 5 to 10 minute warm-up like stretching is recommended. A cool down period of 3 to 5 minutes should be done after any exercise. Go slowly at your own pace. Avoid holding your breath in general, but especially during exercise to avoid increasing the pressure on your heart. Avoid temperatures that are too hot or too cold to keep your heart from working too hard. Avoid exercising right after eating. Please wait 60 to 90 minutes. Avoid lifting, pushing, or pulling anything heavier than 10 pounds or 4.5 kilograms for 6 to 8 weeks. For arm exercises, lift your arms up, down, forward, and back. Also, try to touch both hands behind your back. Suggested ways of working out at home. For the first 3 weeks after the surgery, at home, you can climb the stairs slowly, dust, cook, wash the dishes, set the table, do the laundry. For hobbies, you can go for walks using this suggested schedule. Week 1, walk for 3 to 5 minutes daily. Week 2, 5-minute walks twice per day in the morning and afternoon. Week 3, 10-minute walks, 2 per day in the morning and afternoon. In general, the more you walk, the better. Just listen to your body. Also, you can paint or draw, play a musical instrument like piano. Avoid wind instruments such as the flute. Play cards. Write. Read. Watch television, computer screens, tablets, or phone screens. Use a stationary bike. Go slowly. Treadmill. Go slow. Take a car ride as a passenger. 30-minute maximum for the first 3 weeks. In weeks 4 and 5, you can add the following activities. At home, you can vacuum, wash floors, carry bags weighing less than 10 pounds or 4.5 kilograms, light gardening, planting seeds or weeding, wash the car, go up and down the stairs, take out the garbage, less than 10 pounds or 4.5 kilograms, wash the bathroom. Avoid the bathtub. Do only the sink and toilet. For hobbies, you can go for a walk. In week 4, walk 15 minutes twice per day in morning and afternoon. In week 5, walk for 20 minutes every day. Take a car ride as a passenger, 60 minutes maximum. Play pool. Dance slowly. Engage in sexual activities. Visit friends. Go to a restaurant. In weeks 6 and 7, you can add the following activities. At home, you can make the bed, hang curtains, for example. For hobbies, you can go for a 20-minute walk every day or more if you want. Drive your car. However, it's important to ask your cardiac surgeon if you are allowed to drive again. This is a requirement for the car insurance companies. 8 weeks after surgery, you can add the following activities. At home, you can wring out clothes by hand, wash windows, wash the bathtub. For hobbies, you can go for a 20-minute walk every day or more. You can also bowl, fish. More than 3 months after the operation, you can add the following activities. At home, you can now wash floors with a mop or on your knees. Wax the floors. Move light furniture. Garden, like digging, trimming hedges, etc. Mow the lawn. Shovel the snow. Split wood. For hobbies, continue to go for a 20-minute walk every day or more. You can also play badminton with 4 people. Golf using a pull cart. Sail in a small boat. Play ping pong with 4 people. Play table tennis with 4 people. Swim, canoe, cross-country ski, skate, play hockey socially. After 3 months, it may be possible to take the airplane, but ask one of your doctors for approval. Most travel insurance companies require a minimum of 3 months after the surgery to be insured. Your health condition must also be identified as stable by a physician. It is important not to overwork yourself or try to do too much too fast. If in doubt, do not hesitate to contact your family doctor, cardiologist, or cardiac surgeon. Return to work. Returning to work can be easier if it's not physical and does not require heavy lifting or carrying. It is also recommended to not overexert yourself during physical work. You should be able to return to work part-time or full-time 3 months after surgery. However, please ask your family doctor, cardiologist, or cardiac surgeon if your condition is safe to return to work. If your job is very physical and requires a lot of effort, you should ask yourself the following questions. Is my job physically demanding? If your job is very physical, such as you walk a lot, you often go up and down the stairs, you climb a ladder several times a day, you must lift heavy objects, 20 pounds or 9 kilograms and more. It is very important to ask your family doctor, cardiologist, or cardiac surgeon what you can and cannot do at this point in your recovery. Is my job in a very hot or very cold environment? If your job is in a very hot or cold environment, your heart will work harder as mentioned earlier. This can make it more difficult for you to return to work. Is my job stressful? If your job is stressful, such as you are always overworked, unfair treatment, an unpleasant work environment, unpleasant and difficult colleagues, etc., it will be important to manage this situation as quickly as possible to manage stress during your recovery. Does my employer offer a modified work program? If your employer offers a modified work program, it will be important to adjust your job duties according to your physical abilities. The goal is to gradually return to work if possible. It is extremely important to talk to your doctor about the tasks you need to do at work to make sure that it does not impact your recovery. We must go slowly but surely. Be patient. A reminder about smoking. It is best not to smoke, as this delays recovery from your cardiac surgery and increases the risk of complications. Frequently asked questions. The incisions in my legs and/or chest still have fluid leaking out. Is it normal? As mentioned earlier, a small amount of pale yellow fluid may come out of the incision. This is normal. However, if the fluid is thick and white-brown in color, with or without an odor, call your family doctor or your cardiac surgeon. If you cannot reach them, please go to an outpatient clinic or a hospital emergency room, as it could be a sign of infection. My incision is covered with little scabs. Can I still take my shower? Yes, you can shower, but you should avoid saunas and hot tubs. Your family doctor will tell you when you can start using them again. When showering, wash gently with mild soap and rinse your skin well. Please avoid direct water jets on your incision. To dry your incisions, pat lightly without rubbing to avoid breaking the small healing scabs. Then, leave your incision exposed for 10 to 15 minutes after showering to allow it to dry completely. How long should I wear my chest binder? If you have a bandage on your chest, continue to wear it until your family doctor sees you for your first follow-up appointment after your surgery. You can wash it with mild soap and water and hang it to dry. The leg where the vein was taken is still swollen. Is this normal? Should I continue to wear my compression stockings? In some cases, your doctor will prescribe compression stockings. And, as mentioned earlier, the swelling in your legs will decrease over time. Please walk regularly, standing up straight to stimulate blood flow to your legs. For compression stockings, you should wear them for 4 to 6 weeks or more if your ankles remain swollen. These socks improve blood circulation in the legs and help reduce swelling in the legs. Wear these stockings during the day and remove them at night unless otherwise indicated. The extra strength Tylenol is not strong enough for me. Can I take other medication? If the extra strength Tylenol is not strong enough for you, please call your family doctor. Some pain medications are available at the pharmacy without a prescription, but you should talk to your pharmacist. Some of these medications contain a small amount of codeine, so it's important to talk to your family doctor or pharmacist to avoid constipation. I've been feeling constipated several times. What should I do? Some pain medications and a lack of physical activity can cause constipation. If you are already drinking 1 to 1.5 liters of water a day, about 4 to 6 cups of water, and eating high fiber foods, you may need to take some laxatives. Metamucil is an over-the-counter product that you can try. If nothing is working and you need something stronger, please contact your family doctor or pharmacist to explain the situation. When can I start driving again? As mentioned earlier, most people can resume driving their cars 6 to 7 weeks after surgery, or a little before. However, please check with your family doctor, cardiologist, or cardiac surgeon to see if it is safe for you to start driving again, depending on your health. After surgery, accepting a variety of emotions. Recovering from cardiac surgery takes time, both physically and mentally. Each day will be a little better, but expect to have good days and bad days. This is normal. If you feel that your good mood is not returning 2 weeks after surgery, do not hesitate to ask for help by calling your family doctor. This is very important and necessary. Remember, your family doctor, cardiologist, and cardiac surgeon are there to ensure your well-being. Take it one day at a time, and most importantly, stay positive. Happy recovery.